Claire Louise and Andrew, if I just stay off mute, and I can see who's coming in the chat bar, you can keep me right. And welcome along, as I said. And the first thing I'll do is I'll ask if apologies have been taken and noted to you, Andrew, if there's any of them.
Yes, convener, I've got 4 apologies. One from Councillor Burgess, Councillor Cameron, Councillor Stephen, and Councillor Weir, with Councillor Weir being substituted today by Councillor Goldie.
Right, that's great. Thanks for coming along with it. And that's the apologies. And based on who is here, item 1 is, as always, any declarations of interest in any of the items that are appearing. No, we're okay with that. And that then takes us on to what is seen here as presentation. Morag, you're there, yeah? Morag Dendy? Morag, I see you there. You're taking the presentation and you're also taking all the way down to 5.
Sorry.
Right, Morag, are you taking 2, 3, 4 and 5? Yeah. You okay there, Andrew?
Hi, convener. I think we've got Claire attending to present, and Morag's going to take 2, 3, or 3 and 4, and I'll then come in for the balance of care paper. And if we can't get Morag in between myself and Alice, we'll cover the rest. But hopefully, Morag will jump back on screen.
That's great. That's great. So presentation was the paper was put together by Morag. Is Morag taking that one? We're going to that just now.
Claire.
Oh, is it Claire? Sorry, Claire's giving us a presentation on the technology, the use of technology.
Hi there. Hi everybody. I'm just going to share it. 2 seconds.
Fire away, Claire.
Hi, I'm Claire Farron. I'm one of the service managers working in adult services, and I've got a remit of assistive technology. And thanks for having me here today. I've got a really nice job of updating you on all the fantastic, exciting work that our teams and social work are doing with assistive technology. We've loads of developments underway, but I will try and keep this really short. But if you've got any questions, please don't hesitate to contact me afterwards. Our bid to Scottish Government's digital office for £85,000 was successful, and this will allow us to employ 2 staff to help us conduct a scoping exercise to allow us to be ready for analogue to digital telephone switchover. Now, we know this has actually already started in our communities, but it will be complete as early as 2023. We currently have around 7,500 people with analogue community alarms, and around about 1,000 of those people also have assistive technology, which is dependent on the analogue community alarm. So this is an exciting opportunity, and we'll no doubt be asking for your support later in the year to test some new digital devices in your own homes to help inform our plans moving forwards. A small amount of the money is letting us work alongside many other partnerships to develop a national data set for community alarm performance. Of all the current users of community alarm services, around 13% have assistive technology in the way of safety and motion sensors. These are all analogue devices, and they're all very reactive. All the devices we supply are available to see our assistive tech flag. So what will digital devices mean to the people receiving our services? Well, digital technology brings with it huge benefits. Services can be planned to be proactive, re-abling and predictive, and evidence so far of other partnerships that have already migrated is showing that services can be much more efficient. So analogue to digital, although the switchover feels a bit challenging just now, it brings with it great opportunities for it to improve the way we support people living in North Lanarkshire. We do have some digital devices currently that don't link with our analogue community alarm service, but are standalone digital devices, such as GPS devices. Alerts for these devices go to people's families. We're able to keep people safe that may have been at risk of becoming lost. Activity monitoring is another digital device we use. We're able to monitor someone's activity levels throughout the day or night. These, like the GPS locators, have very clear privacy and consent protocols around them, so that we're not overly intrusive in someone's life. They can be very helpful to identify if services and supports are needed at all, and what levels of services and supports are required. A very simple example would be we can put a sensor in a kettle to establish if someone makes a cup of tea. Within our Assistive Tech Flat, we have a large variety of digital tech for demonstration, including Alexa and Google devices. I wanted to give you a couple of examples of when and how we're using technology. One of the localities I've been supporting a young man who's got a very complex physical condition which affected the development of his joints. It basically means that he's unable to use his arms and legs and has no mobility. And before we got involved, he was having to turn lights on and off using his nose. At first, we were looking at environmental control systems, but these systems which are provided by health are very cumbersome, very expensive and quite complicated to use. So through the use of smart plugs and Alexa, we were able to allow him to control lights in his television, etc. The social worker then applied for ILF funding for this equipment to allow him to retain his independence. He was then provided with this equipment plus a further tablet from a Connecting Scotland phase that he can use with the setup. The next example is a lady who has multiple complex physical and mental health conditions. One of these conditions results in episodes where she inserts and eats non-edible objects, including things like baskets and buttons. And due to this, she's had numerous hospitals admission. And following a lengthy hospital admission, it was assessed that the lady required significant and continual supports 24 hours a day. Work was undertaken to look at how to provide the supports that would manage the significant risk factors while balancing her right to a private life. The lady's family are a welfare guardians and they are fully involved in all aspects of care planning. The lady wasn't keen on having support staff stay in her home, and they were concerned about how she would cope with having people in her home all day. Working alongside health colleagues and care providers, a bespoke package of technology was put in place, including thermal imaging camera with shock sensor utilised to detect internal body heat changes in the lady overnight, motion PIR sensors to raise alerts if she left her bed and didn't return, door contacts to alert if she attempted to open her door during times when she was alone, responder service activation button and ability to activate via Alexa device. And this can be utilised by the lady to request support or seek reassurance in any emergency situation. And we linked up carbon monoxide and smoke detectors to our alarm receiving centre. All this meant that there was no longer a need for people to be with her in her home 24 hours a day. She feels safe and secure, her family are reassured, and reducing anxiety. Thanks so much for listening to me today. If you've got any questions, please don't hesitate to email me on the email address on the slide.
That's great, Claire. Thanks very much for that. Well summarised. I had seen the written report, but I hadn't seen the presentation until the papers come out at the weekend. So members will have seen the two of them, and it's an ideal place to see a summary of what was issued to us. Can you just clarify your position? Are you dedicated to the social work, technological progress and development? Are you in social work itself, Claire? And is that DL House that you're based in? Or do you have other remits? Albeit that we're sticking to this particular report in development of adult health and social care.
Yeah, I've got lots of remits, as I'm sure we all do, but one of my remits is obviously the oversight of assistive technology. For some unknown reason, I think I'll send the slides out with the slides round with notes if that's okay, because one of the slides, number 2, kind of for some reason the video didn't work to kind of explain all the different really good pieces of work we're doing.
Yeah.
we've actually won a Connecting Scotland bid as well for 100 devices and MiFi units to support older adults and people with learning disabilities in our communities. We've also got the Assistive Technology Flat, which, as you know, is filled with a huge amount of really good technology, that stuff that we provide, but also stuff that people can test, that they can buy themselves. And we've got, so we're just getting, for example, robot mop. Who even knew a robot mop existed until until now, but it does. So we're getting that for the flat. So we've got there's loads of pieces of work that are really exciting and really ongoing just now. The analog to digital work stream in itself is a very big piece of work, and what we're trying to do is we're trying, obviously in social work, but we're trying to join up all the dots. So we're trying to make sure that we link really well with our housing colleagues, with our health colleagues, across all the different services, so that our assistive technology is really well joined up across the organisation. Yeah.
So that clarifies it's part of the overall transformation. I'll come back to you when I've allowed members to ask questions, because there is something on that Connecting Scotland Fund, ironically, that triggered that particular question to you, and that bid that we made and where it's going to go in the future. But I'll let members in first before, if I need to come back to that clarification, I'll do so after I've allowed members to come in, if there's anybody wishes to make any submission.
Councillor Barclay has indicated she wishes to come in, convener.
Councillor Barclay. Claire?
Thanks, Tommy. Thanks for that great presentation, Claire. That was wonderful, and it's always good to hear from people that are actually doing the work as well. And your enthusiasm is marvellous. Just to ask, how has the people that you're dealing with sort of engaged with it? Are they really pleased that it's going to be the new technology? And how are you dealing with maybe elderly folk that aren't quite into it now? It's unfair, because I know a lot of elderly folk that are so into IT, they would probably do really, they put me to shame. But it's about, well, you know, Tommy's laughing, and no wonder. But it's about looking at, how do you engage with people who are fearful about this changeover, especially when it relates to their health?
Yeah, there's a few points there. Bear with me. I think you're absolutely spot on. I think older adults, there's definitely a confidence issue there, and we've maybe not had the supports available. So what we're doing is we're currently training digital champions across the organisation, and part of the Connecting Scotland bid, we actually had to say that we would actually support people and care manage people for 6 months. So we'll actually provide support to help them set up the device, but then provide ongoing support. So we have to make sure that our infrastructure is such that we can actually be there for people and support them as they get wee questions. I'll give you an example. One of the areas I put out to last week, and they contacted all the people that were receiving an outreach service from Integrated Day Services, which, as you know, is still existing, and about 20 people want to engage in this already in that one locality already, and that was only last week that I'd asked to ask. So I think people and their families are really keen, and they're really keen that people stay socially connected, and this is a way we can do it. We use Near Me and for virtual consultations across the organisation, but our uptake hasn't been as good as it could have been, and a bit of that, I think, is our staff confidence, which we have to recognise as well as a barrier. We need to work with staff to ensure that they feel confident to use the technology. But a big barrier is that a lot of people in our community, they might have a device, but they don't have Wi-Fi. So actually, the Connecting Scotland bid doesn't just give you a device, it also gives you a MiFi unit that you then have a Wi-Fi within your home. So we're providing training, we're going to provide support, we're giving them the device and the MiFi. So actually, I'm hopeful we can get some really good learning from this and support people. I think community learning and development are incredibly supportive, and they're really skilled at training older adults with technology. So I'm working really closely with them. I'm also working really closely with housing to make sure that people who are living in an NLC property, we're capturing some of that data as well. So it's not just about social work, because obviously we work in all tenures, but it's about what does that look like for people that are living in NLC properties as well. So we're capturing some of that separately for housing, just so that we can be more informed moving forward. Does that answer? Is there anything else?
No, that's great. Thank you so much
Yeah.
for that, Claire. Thank you. Appreciate it. Thanks,
No problem.
Tommy.
Thanks, Claire, and both Claires. And I'll come back on the point that Claire Bartley has raised there. Claire has touched once again on that Connecting Scotland issue that I'll keep in abeyance, because I see Agnes, Councillor McGowan is wanting in. Agnes? Yeah,
It's not a question, Tommy, so it's just
no problem.
2 remarks. Number 1, where do you get a robot mop? I would like one of these. The second comment is you're talking about near me in paragraph 2.5. It's absolutely wonderful. My husband's getting speech therapy, and we would have to travel to Monklands to get it, and I was slightly worried about going to Monklands with COVID and things. And the lovely speech therapist Jill said, well, you can do it through Near Me and do it on your computer. And I must admit, I thought, that'll not be as good as face-to-face. It's absolutely brilliant. It's amazing. It's as if she's in the room, and I'm totally sold on Near Me. You can contact her any time and speak to her just as if she was in the room. So it's an amazing facility.
Great, thanks, Agnes. Brings it home just not just how beneficial they are, but how much incrementally we're going to become dependent on this whole development. Claire, see, based on that and how much we're going to become dependent, I was interested in the response you made to Councillor Bartley's reference to acclimatisation of individuals. And you said that we had a bid in, as referred to section 2.3, Connecting Scotland. We had a bid in there. I didn't get clarification at conveners, but to develop that point, you hit the nail on the head when you said the problem is that there is no Wi-Fi. I notice in here that we're at a bid went in and we actually were successful for 100 of those devices. You take the bigger picture, we're actually a victim of our own success, because in the same report you're referring there to a high number of people, or the low rate of people going into care homes. So there's more people at home, will become more dependent on technology such as this progresses. Now that's for the future and the future trend there in the big picture. But can I take that individual picture on Connecting Scotland and find out, can you give me a specific, we said that we're targeting that, and rightly so, towards those at the bottom end of the socio-economic scale. How many are we talking about here? And how long do you think it will be before we can roll that out? Because we know the benefits. You know, you've displayed that here, supported by elected members. How many numbers are we talking about there throughout North Lanarkshire that could be on that waiting list? Because I don't think we should be approaching that just from an application for Connecting Scotland funding. Is that getting done at corporate level and a much more bigger application for much more funding if there's such a magnitude of a waiting list?
Thank you so much for saying that, because that's really helpful actually. But I think that the analog to digital work stream, and there's now a board that's been set up, and really we're looking at a progression of obviously the switchover, the telephone switchover, but within that it encompasses a huge range of digitalisation agenda about how we support people completely differently moving forward. And what you've just referred to will have to be part of that business case. And about how we do that moving forward. The new digital technologies are really quite exciting in that, see, even where you have hotspots where you've not got good signal, and we have got that across North Lanarkshire just now. I know there is another whole team that are looking at that, which is great. But actually these new devices, what they do is that they use I didn't even know these things existed, they use a roaming SIM, which actually means that it automatically, like in real time, switches to whatever signal is available real time. So for instance, if it's in Shotts in the middle of winter and the O2 signal goes down, it instantly flips to EE, Vodafone, and it just finds a signal that's actually working. So, because at the moment, for technology, that would just fail in somebody's house. If they were sitting with a phone and EE goes down, that's them, they're,
Yeah.
they're down. Whereas there's roaming SIMs becoming available. So the whole business case, and I would love to come back and speak to you later on when we get much further
Absolutely.
along in that, and actually get your advice and hear from you guys as well about how we move that forward. And I know, and I spoke to Falkirk the other day, and what they were really clear that their politicians were very heavily involved in the testing in a lot of their technology. So it might be that I ask this kind of group to take some of the technology home and try it actually and see what works in all the different areas of North Lanarkshire.
That would be great. I'm
Yeah,
quite sure members would wish to take you up on that offer to return. Come back maybe with some figures that potentially, we're going to have to address here, which will develop the report. Not that the report is short in any way, but will give further information, elucidation, and even a potential breakdown into areas. Without getting too parochial, even a north, central, south, we know as elected members the problem areas, mainly are geographical. Further information on that, what we're doing as a corporate application, that would be tremendous, and I think all members, certainly convening this chair, would agree that would be an excellent idea. If, say, within the next year, you come back with an updated report, Claire.
that's great. Thank you so much, and thanks for listening. Thank
Oh,
you.
been a pleasure. Been a pleasure, and look forward to hearing you again.
Nice to meet you all. Thanks.
And yourself. Thank you. Bye. Colleagues, we'll look forward to that update. It's interesting what's going on out there in the real world, and certainly it's good to see that we're rising to the challenge with the support of these various projects, and we'll get updated on that within the calendar year anyway, at an appropriate time, say the end of this year or the start of the next calendar year. With your approval on that, if we can agree to the recommendations that are on page 5, to note the resources and note the report as Claire spoke to there. That will take us on then to operational matters, the first of which is the advocacy plan, which is on pages 17 to 50. And see Morag? Is Morag joining us? Morag,
Yes, thank you, Councillor Morgan.
You there,
I'm
Morag?
back
Okay.
with you. Yes, apologies. I had a technology fail there, so sorry about that.
Don't worry about it, Morag. You're a technology fail. My loud telephone started going. Somebody's dog's needing fed. So we're dealing with everything today, and we're still managing to stay afloat. So,
real time problems. Okay, I'm delighted to this afternoon speak about the advocacy plan. We are very aware of the important role that advocacy plays in making sure that people's voices are supported and that their rights and interests are protected. And the plan that's included in the report is the 2020 to 25 Pan Lanarkshire Advocacy Plan. This is the third plan bringing together the partnerships between North and South Lanarkshire councils, North and South Health and Social Care partnerships, NHS Lanarkshire, and crucially the advocacy partners that work across both North and South. And it sets out the current provision and the future ambitions for advocacy services. So you'll note in the report that the organisations which support advocacy provision in North Lanarkshire on an age band are both the Equals Advocacy Partnership and Equal Say. Their contracts run out in this summer, so we will be procuring replacement services there. Who Cares Scotland's contract lasts a little bit longer, and Shelter is a very specialist housing-based advocacy provider who sit just below the threshold for tendering, so that's likely to be a negotiated process. The plan, I think, helpfully includes information about the provision of advocacy through this challenging time, through the pandemic. And just as being described in the previous report, the responses and changes made to ensure that people's voices are heard where there's more digital connection and use of a kind of wider range of ways of making sure that people are linked in will continue, because some of that has actually been particularly helpful and ways of making good use of the resource that we've got available, and making it more flexible and efficient. The advocacy plan sets out the legislation which underpins advocacy and goes into detail in relation to the standards which are expected, how they would be monitored, and the action plan for 2020 to 25. Rather than go through the detail, because it's an interesting read, it may maybe be more helpful to take any questions that I think.
Yeah. Can I just ask a point of clarification, because I don't think, thanks for that, Morag. I mean, members no doubt will have read the covering report. The attached document isn't too heavy to read either, but these are sensitive areas that certainly, under the conditions that we're under, there's going to be a greater stretch in these particular services. We're talking here about mental health, healthcare, and so on and so forth. Adult support, drug, what do you call it? Substance abuse, so on and so forth. Adult and drug partnerships. Morag and officers, I noticed that the convener education sitting here was Frank. There's a major chunk of this referring to that who cares, and we know that we've seen in the media reference there to, you know, the tsunami that's ready to hit us here in this mental health issue. Just as a matter of protocol, with so much an input to this referred to education and families, can we get it right? Should this be referred? Do you want this referred over to yourself? Because there may well be members that will want to see this from that perspective, rather than just as the recommendations ask us to do here, note it, and then publish the plan, which, because it's a 5-year plan after all. I'll ask Councillor McNally, the convener of Education and Families, if that is what he would desire, and I'll ask the officers to keep us right in that one. Frank?
Thanks very much, Tommy. I mean, completely share your points there. If it is something that can be referred to the Education and Families Committee for noting, that's something that would be welcome. Alison Gordon's obviously on the call as well. We obviously have had reports on this in the past, and I'll be looking to do that moving forward. But certainly share your view there. I'm happy for that to take place.
Great, thanks, Frank. Alison, I noticed you've come in with a comment there. I don't know if it's while Frank was talking on that on the Who Cares contract. If you wanted to, are you okay with making verbal comment here, but also referring it over to Education and Families? Alison?
Yeah, yes, convener, I'm happy to provide some context if the report, if there's a desire for the report also to have visibility in Education and Families. I suppose it's just to note Who Cares are probably best known as an advocacy organisation that works with young people with care experience. It's just to note that in the North Lanarkshire context, that we have actually, their contract with us is broader than that. So it does include support to children and young people who are involved in the hearing system and who have got additional support needs and or mental health difficulties. So we do have a wider sort of contract from Who Cares, so they're involved in a number of areas of work, and certainly if in consultation, obviously Councillor McNally would like that information shared with Education and Families Committee, I can provide some more detail on that as well.
That's great. We'll just make an alteration to that. Claire Louise and Andrew, that we're referring it over, because it's a 5-year contract, and just to make sure that everybody's notified that these agencies are in place there for the information of elected members. Is everybody okay with that? To note that it's broke down? I thought financially it broke down in a pro forma between ourselves and other local authorities. It's Lanarkshire wide, and if there's any further questions, you could take the issue up with the officers.
Councillor Barclay's indicated that she's got a question, Athena.
Oh, sorry, I didn't see your name there, Claire. Yeah, it's come up now. Okay, thank
Sorry,
you.
Tommy, it's more just a comment. I know that at previous committees that I've commented on advocacy, and I'm a great advocate for advocacy, and it is simply, I know that many of my colleagues, council colleagues, will have been involved with cases where if it really wasn't for the advocacy service and people like Who Cares and others, the outcomes would not be as successful as they were. So I've just to say thank you, Morag, for the report, and I agree with your comments on it, Tommy.
Thanks very much, Claire. Much very supportive, and obviously officers can take those comments, positive comments, and recognition by elected members back to those involved with these organisations. Could we then just formally accept the recommendation that's on page 18 with an appropriate alteration to include a cross-reference over to the other committee that will keep members informed there who may have a direct input to educations and families reference within the report, but from our stage, we'll note that report with that slight alteration. That agreed? Thanks very much, colleagues. That's the advocacy plan for, as it says, 2025. Taking us on, Morag, if you're okay with the carers and the waiving of charges.
Yep, thank you, Councillor Morgan. The next report then is equally as important an area in relation to ensuring that we've got the range of responses right for carers. The introduction of the Carers Act included section 24, which recommends the waiving of charges for carers. So this report is brought with the guidance that's been developed in relation to how that applies in North Lanarkshire. So the arrangements are that charges which relate to support, which is particularly for carers, should be waived, but charges which apply for the cared for person continue as normal. So there's a wee bit of a difference between the interpretation of the way that works for people. And that can be a bit confusing because there's clearly a very close relationship between the support that's there for the cared for person and the support that's there for the carer. And so the guidance is trying in a fairly straightforward way to describe some of that, but it's saying, first of all, importantly, that that in terms of being consistent and transparent and developing this this guidance in partnership, that it needs to start with a good conversation with the carer and understanding their circumstances and what's important to them, identifying what they want to achieve for themselves and for the person that they care for. It describes the eligibility criteria, which covers low, moderate, crucial and substantial caring responsibilities, and requires an adult carer support plan. And the route to get an adult carer support plan in North Lanarkshire are the Lanarkshire Carers Centre, any of the carer support workers, and any of the social workers or care managers involved in somebody's care. And I suppose important to remember that lots of the response to carers, particularly information, advice, some of the alternative therapies and things which are available for carers, continue all to be delivered free at the point of use. So there wouldn't be any expectation that that would be incorporated into the waiver of charges, because we don't charge for that in the first place. Arrangements in relation to carers are to some extent similar to people that are cared for, in that individual budgets through the principles of self-directed support are available to carers, but in a slightly different form. And we have developed guidance which really means that between £250 and £3,000 in a year is available to carers to support them in their own specific needs rather than the needs of the person. And the I suppose the crossover arrangements are more about replacement care. So replacement care really means where the carer would offer support to a person, and that's done in a different way for a period of time. So it could be for a couple of hours, it could be for an overnight, it could be for a few days. The replacement care could be family members or another service, and could include residential respite as an example. Many of the services to the cared for person aren't charged for directly in the council's arrangements anyway, but some arrangements are paid for in relation to residential respite, and the waiver of charges really allows consideration through the adult carer support plan to waive up to 50% of those charges. So the kind of the bit that would benefit the person would remain charged for, and the bit that would benefit the carer would be waived. So you can see that there's a bit of a combination of responses in the guidance, which are intended to make it clearer and recognise that there's a really important interface between the cared for person and the carer's role.
I think there'll be a, what do you call it, unanimity of making sure that this continues, the waiving of these charges. I mean, I don't think anybody would even consider or elicit any consideration to bringing charges in here where at all possible. I believe that's been the case since 2018. There hasn't been any, and it should continue that way, as Morag's referred to over the report. And if you go through the report, I think we'll all agree. We note the report and we continue with waiving any charges that do come any individual's way through those offers that or facilities that are contained within the papers in front of us. The recommendation itself is just that we do note the report, and it's on page 51. And if we could agree to that.
Convener, Councillor McGowan's indicated she wants to make a comment.
Sorry, Agnes. Before I ask people to agree, I'm going to get into the habit of flicking down the right-hand side there. See, Claire Bartley, you're not the only one that's the rudimentary or the foundation level. You can still use that in educational terms. Foundation class when it comes to technology. I'm going into the habit of looking there, and I see. Sorry, Councillor McGowan. Sorry, Agnes. I was ready to move on, but certainly in you come. Thank you.
It's all right, Tommy. I'm used to being ignored.
But you were a day to your head, then.
No, I just want to ask a question. You know, it mentions Morag talked about respite care, and you know, talks about respite care, and I think it's amazing that you know, charges are being waived. But how easy is it to get respite care? You know, I know in the past that, you know, I've heard instances of people wanting respite care, but homes, you know, care homes don't want to take people in the short term because they haven't done, you know, all the tests, and they don't know exactly the condition of the person. And so is it easy now to get respite care?
Well,
Thanks, Agnes.
What we've always had in North Lanarkshire is quite a broad approach to what having a break means, and for some people that means a break from routine, not necessarily a break from each other. So some people have accessed resources to go on holiday or spend time with other family members. So there's lots of different ways to do it. In relation to the current experience of restrictions which apply because of the social distancing and COVID, yes, that has had an impact on people's, not so much their access to respite, but their desire to be in respite because of the need to self-isolate when in respite. So there hasn't been as much focus on people using buildings-based respite like that, although clearly there are nursing homes which have provided that, and few in Motherwell have continued to provide to a broader range of people. But the opportunity for shorter breaks and support at home to allow carer to go out and spend a bit of time themselves or do a bit of shopping, whatever they want to choose, to create that break in their routine, all of that is as available as it can be just now. The limiting factor really is people's desire not to have increased footfall in their home. So it's a balance, because it's really important that it's available to people and that they know that they can access it. But the balance for folk is how that balances with the risk that people coming into their home poses.
Agnes, are you okay with that? I mean, is it the fact that people are presumably, hopefully, once we get out of this horrible situation we're in regarding the social distancing, etc., we know of the case that was in the media, the few organisation in the Motherwell area, I think they had a problem with this. It was really down to social distancing. You talk about cognizance or awareness. Is that what basically what we need to look at once we're through this negative period of time?
Yeah, it was really more when we're out of COVID. I know COVID's
Yeah.
causing, additional problems, but it was, in normal circumstances. And it was really, I was really talking about care homes. If if it was not possible to have somebody in their house 24 hours a day, and they needed somebody 24 hours a day, they would need to go into a care home. Are there spaces in care homes, and are care homes prepared to offer respite, for a week, 24 hours a day? That was really the question I was asking.
More on the point that Agnes has raised, could we take that as part of a report that comes out about awareness raising? We know we've got confidentiality and how many cases are applied for. Could we take that as a future report? I don't think it would be helpful to base it on a COVID situation, but in the future about how we actually make sure that people are aware of that particular facility. That could be included in a subsequent report that comes to committee.
Yes, absolutely. Members will be aware that I suppose talking about the waiver of charges is only one very specific aspect of the work we do to support carers in North Lanarkshire, and the Carer Strategy Implementation Group, which has wide representation on it, are obviously very interested in making sure that we've got demonstration of the range of supports and services that are available to carers, and that they are doing what we hope that they would in terms of ensuring that people have got arrangements which sustain their caring role. So certainly in terms of bringing a wider report on the arrangements in relation to carers more generally, I would be happy to do that, and within that give any further feedback on the position in relation to waiver of charges.
Consideration of that for once we're through COVID is a presentation that they had earlier there, just that length of time, that period of time, summarised report, and someone from the group speaking to that I think would be most helpful for members of the committee to enlighten us of all areas of that particular group, as well as us as elected members for our constituents. I think that would be ideal as a presentation, maybe in a couple of cycles' time. Can we agree to that now? Thanks, Agnes. I see you support that. I'm glad we raised those points because it does give us good ideas, and that's why it's helpful here to tease these issues out, and we learn as we go along. So on the actual specifics of the waiving of the charges, if we can agree to note that report now, and also Claire, Louise and Andrew, if we can get something in there that a presentation later on will be done by the relevant group that Morag mentioned, and that will come to committee at a cycle later on in the year. Okay, thanks very much, colleagues. That's item 4 completed with. Morag, you still with us? Taking the balance of care. I should think of your balance of care and could hand it over to Ross here if you wanted.
Yeah,
I'll pick this one up, give Morag's voice a wee break.
Yeah, you've got to consider the balance of care here. Morag there,
exactly.
Balance.
Exactly.
Thanks, Ross. The balance of care, item 5, folks, pages 67 to 74.
I think this is a really important one for the committee, and I suppose the really important aspect for me here is we actually look at the sort of journey we've been on as a partnership, which actually predates the IGB integration, etc., and goes back, at least 10 years as a sort of integrated piece of work across North Lanarkshire as a whole. And really the journey we've been on over that period of time is now really starting to show itself through in the national figures really quite positively. So a huge range of work, and this works through particularly the work and rollout around self-directed support in North Lanarkshire, but also underpinned all the work we did through the Reshaping Care for Older People programme, etc. as well. And really focused on how do we support people to remain as connected as we possibly can in their own community rather than within institutional care. And I suppose it's taken quite a lot of significant amount of time and effort to get us to this stage, but as you can see in the figures, it now really shows through in terms of the impact that has had, and I suppose just continues us on this journey. We're certainly not complete by any manner of means, and we will be continuing to try best to focus on further developing this in this direction in the years ahead. So we take the graph at the top of page 69. It shows that the percentage of people aged 18 plus with long-term needs receiving personal care at home, with North Lanarkshire the highest partnership in Scotland at 74.4%. And again, if we look at the chart below that, that's then looking at the percentage of people aged 65 and over with long-term care needs receiving 10 plus hours of home care. And this was a measure particularly in years gone by where 10 plus hours was seen as a really significant care package. And we'll probably move beyond that because we'll have quite a significant number of individuals who will be receiving that type of level of care in the community now in North Lanarkshire. It's now not something to be seen as at all abnormal. But again, you can see us at 45.4% and right up the good end there in terms of the national comparisons, in terms of us being able to support people to live at home. If we move on to page 70, this is now looking at the registered care home places for older people in the population, and again, we're significantly below the Scottish average. And then if we have a look at the rate per 100,000 per thousand population, sorry, on page 71, again we're the third lowest partnership in Scotland in terms of our care home use. And then the 2.3 section 2.3 of the report is then starting to have a look at the associated expenditure within this, and obviously we've gone through a significant process within the council where we've now really only got Muir Park as the only in-house care home registered with us, and it's no longer a long stay care home, it's an intermediate care facility. And based on that, you can see the change in spend as well. So again, we're down the bottom end in terms of Scottish benchmarking for spending social care services, and that's largely down to the fact that we have been able to make such a shift towards being able to support people in their own homes. And connected in their own communities rather than within institutional care. So you can see quite a significant impact there, both in terms of the outcomes for individuals, but also in terms of the overall cost profile for the council. So as I said, I mean, I think there's been a lot of work done nationally just now, looking at, I suppose, trying best to get to a stage where we have less postcode variation in terms of provision, etc. And it's just really nice to see the impact of all the work over the last decade and more in North Lanarkshire really coming to fruition, as you can see in the figures. And really, I suppose for the committee going forward, really gives us our direction of travel that we want to keep developing in that area as far as we possibly can. And I think the one bit just to leave on is the fact that it was a national conference last year, and it was just a really thought-provoking piece where they were saying about we shouldn't just be looking at balance of care in terms of how many people are at home versus being in a care home, because if you're stuck in your own home all day and the only four walls you ever see is in the living room with no real connection, it's no quality of life. So we need to make sure we maintain the focus on community connectedness as much as balance of care to ensure we deliver those type of outcomes.
Thanks very much, Ross. I mean, we're always cautious of statistics, but certainly based on these ones, we could embrace these, all because we come out on these charts looking so well. But we can obviously see the direct connection here between the presentation that we had earlier and the impact that it's having positively on the charts here. But I mean, other than what's contained within the report, I'm always cautious, Ross, when they say that we're spending less than everybody else. I don't necessarily take that. I know some people like the improvement services say you should spend less and that puts you in a good group. I'm very cautious of that particular mentality. But I know what it's saying there. It's because we've got other services in place to give and provide and maintain what the subject of the report is, that ideal balance of care. So if anybody's got any comments, Claire, maybe an anecdotal example or whatever on this particular area? Or any questions for clarification?
No, it's just I was glad to hear, and I wasn't surprised to hear what Ross said at the end about it's about trying to get that balance right, and it's looking at folk who are in their own home and they're in their own home for all the right reasons, but it's about the isolation not being the inclusion that we need to cover, and it's how do we make sure that that gap is bridged. Because it could be that for somebody who is, we're doing all the right things by making sure they're staying in their own home, but the only people they see is maybe the home support that's coming in. It's how do we pick up those people and make sure that they don't fall into a gap, and also that I think we're getting the balance about right, but it's about ensuring that if that somebody has either they've managed to remain in their own home for a good length of time, but it comes to a point where they do need the care, the 24-hour care that being at home cannot deliver. Are we, by going down this route, are we still keeping a bridge of making sure that there's going to be places for these people within a care home, considering that as part of the council we only do have one facility, that we're relying on the private sector having that. So that's the kind of the two things, Ross, about how do we make sure that there's we don't have people falling into the gap of loneliness and not being included and all of that because they're in their own home, and also about there being places if they need to be. Thank you.
Excellent teased out points from the report there, Ross, to address.
Yeah, I mean, I think that there's something we could probably bring back through committee that would probably be quite helpful around this area, around the Community Solutions Programme through VANEL. And clearly, a huge element of our work around this area sits within the third sector. And just as an example, we're just at the moment rolling out a programme with VANEL around digital inclusion, so that we can try best support individuals to be who are isolated just now and with all the challenges around the pandemic, so we can actually do some digital befriending, etc. So we're currently recruiting volunteers for that type of approach. If members remember back to things like the new model of home support, one of the pieces we put in within the Rainbowment process was we extended the sort of maximum period for Rainbowment to 12 weeks, and that was again one of the key rationales for that decision, was so that we could actually spend a bit longer in terms of trying to best identify and support around isolation, loneliness, etc. As part of that programme, where some other areas that had gone down that approach had only gone for a sort of 8-week programme that we felt would be too constrained to actually allow that type of input to be taken forward. So there's certainly a lot of work going on in that area, and again, that's something we could bring forward to committee in a future report, and just setting out, because the numbers that have been supported and continue to be supported through the third sector are really quite amazing across North Lanarkshire. In terms of care home capacity, it's a really interesting area, and a lot of sort of national focus on this just now, particularly off the back of the pandemic. And as Morag's previously picked up on today already, that we can see already some sort of shifts in areas of demand for service through the pandemic, in terms of people being a bit concerned about the number of visitors in their homes, or whether it be actually the safety within the care home environment as well. So it's going to be really interesting to see where that demand falls and whether or not we see a bit of a shift from the type of care home environment to things like very sheltered housing and that type of approach, etc. over the time to come. It will take some time before we get that understanding, but I mean, there's certainly a lot of national focus on that just now, to have a look at what that shift looks like. And certainly in terms of care home, we've done an awful lot of work, both before the pandemic, but an incredible amount of work just now through the pandemic in terms of supporting the care home sector. And I can give more detail if you'd like it, but I know we've had weekly calls with all the care home providers throughout the entirety of the pandemic to provide support, etc. And we found that incredibly helpful from both directions, I think, in terms of providing that support there. So we know I suppose the stability of that sector is vital, and still being able to offer that alternative, because I absolutely take the point that it becomes a stage in some people's lives where that is the best place to be able to be supported. So we need to be able to continue and support that that offer as well.
Claire, I mean, those are offers I think that Ross has made that we should bring up. I think we should keep a discrete separation between the two reports. Obviously, they don't need to come back.
Yeah.
The third sector is something I've been meaning to get further information back to members on for some time, and that has provoked or agitated for that type of report. There'll be reports going to policy and strategy next week and strategic funding, and I don't know if maybe we should keep an eye. I don't know the contents of that, and obviously in the run up to budgets coming up, the third sector is something that we have to keep an eye on, that it's appropriately funded. You can't criticise your own services disappear. So you're okay with bringing that one up at a later date, and we can word that in the recommendations. On the other point, Morag, I know you mentioned these before, these almost daily calls, the phone arounds that you were doing. Is that still ongoing? And as things have, maybe don't want to tempt anything here, as things have dipped slightly, is that still an ongoing procedure that's given a lot of comfort to everybody involved on a regular basis for the care homes?
Yep, the weekly calls, so we've got a range of things, and we've got senior officers who link with the homes on an individual and individual person basis much more frequently, but we've got video conference calls on a weekly basis with care homes, and also with care at home and with supported living providers. And the only reason we divide them up is because sometimes the issues are a wee bit different, so it helps to, the care home, the care homes can helpfully come together and learn from each other about how they're managing issues, what they're developing, and kind of create strength around that agenda. But I think that that's been a really good way of having very regular dialogue, really key people involved, so colleagues from health, from infection control, for example, and from care home liaison, from the care inspectorate, from Scottish Care, and council officers get a chance to have that dialogue on a weekly basis. And I think it really strengthens the sense that we're working in partnership, that we've all got something to contribute, and we all need to hear and learn from each other in terms of what makes good arrangements going forward, very much on the basis of what makes good life, not just services that seem safe and meeting basic standards.
And I think Claire did the presentation earlier, referred to that these are areas that, without that technology, that have an impossible to have that amount of cross-reference and information on the regular basis that was needed and still is needed at the time. So taking Claire's points on board, can we agree to bring those, put that within the recommendation, albeit that we're agreeing to note the report and the aspects of the report in relation to the third sector involvement. Andrew, I'll leave it to yourself and Claire Louise to get the wording from Ross. We'll put that in there, and maybe we'll wait until after the budget procedure. An ideal time of year we can bring that back when we see what they've been budgeted for. Not that they're doing nothing just now, but an appropriate time once their funding's in place. Because obviously it's better speaking to your report when you know what funding you've got, and you can guarantee speaking to a report when you don't know what the future holds regarding your finances.
Convener, Councillor Fannin indicated to me, she sent it as a private message that she wanted just to say something on this report.
Certainly, Julian, in you come.
Hi, I've just a quick question really, Tommy. I wanted to ask about the support, the weekly support that, you're checking in with the care homes. What sort of issues are coming up with, with those check-in calls? And also, has the care inspectorate identified any sort of major issues with care homes in North Lanarkshire during the pandemic?
Great points. Morag, you'll be the one that's obviously right in the eye of this storm to answer that. If it's possible.
If Morag can't get in, I can pick up. Is that you, Morag?
No.
If you could pick up the now anyway, Ross, and more
Okay. I'll start us off. So there's been a whole range of issues. So we've been doing a whole range of supportive work with each of the care homes. Some of this is around payments, so to support them. So we've got a whole range of nationally agreed payment support we can put in place for private providers. So this is things like payments for staff who are out off isolating, etc., as well as some payments for, so if, for example, if a care home has had a few deaths related to COVID, then we can provide financial support for covering off some of that. We've got a wider care home assurance group that meets on every Friday on a weekly basis, that myself and Alison, Morag, all our counterparts in the South, public health, infection prevention control, health protection, etc., are all included in. And that is a group that then starts to look through all the different asks and supports that have been put in place across all the different care homes in Lanarkshire. Anytime there has been an outbreak of COVID in a home, we then go out and do some targeted visits with the home to go through infection prevention control measures, health protection team get involved as part of the outbreak management, etc. And there have been a number of different support plans put in place off the back of that. The Care Inspectorate are part of that group. So we've been doing work, for example, just in the last fortnight around infection prevention and control. We've had the infection prevention control nurses out doing audits across the different care homes and taking pictures and doing and that sort of thing, just exactly the same way they do with the hospitals as part of the hospital inspections. And then we're presenting that back to each of the care home managers as well, just showing the sort of best practice we've identified when we've been out, and also areas of practice where we need to find improvements. I mean, I suppose that the striking part of that for me is that it rings very true. I've been through the process many times with the hospitals as well, and it's the exact same type of things that we're finding, that we're trying best to support the homes. And it's a lot of this is about actually quite basic pieces around how do we make cleaning much easier as part of the process, and no clutter around different areas, about how we do things like the management of patient slings or service user slings and things like that are all individualised, maintained in their own room, so there's no opportunity for cross-contamination. So all that sort of thing, it's the exact same sort of bits that have come up through hospital inspections in the past and that we're working on. And obviously, as part of the process, we've got Care Inspectorate involvement as well. So, for example, within South just now, we've got a large-scale investigation kicked off in one of the care homes off the back of one of the inspections that we undertook through this process. So there's a whole range in there in terms of what's been identified, but we've got now a process in place where we've got quite significant support and also scrutiny across all the different care homes in Lanarkshire. I don't know, Morag or Alison, was anything else you'd want to pick up on top of that?
Thanks, Ross. Morag, Alison?
Alison.
Alison?
Sorry, apologies, problems with my mute button. Just to pick up on what Ross has said, I mean, in addition to the particular additional assurance arrangements that have been put in place because of the pandemic, we obviously, anyway, through our quality assurance arrangements, keep up monitoring arrangements and contacts with our care homes. And the other thing that obviously we do, and we've been asked to escalate as part of the response by Scottish Government, is to make sure that we undertake reviews for all of the individual residents who are being cared for in our care homes at the moment. So we're planning for that as well just now. Those are both things that we would have a programme in place for anyway, but we are escalating and giving it additional scrutiny because obviously not only are there concerns around particular vulnerabilities of individuals in care homes because of risk of infection through the pandemic, but obviously people's lives within care homes have been significantly impacted by the restrictions. So what we're also trying to ensure that, in as far as possible within those restrictions, that people are being supported to lead as fulfilling lives as possible, and that some of the other aspects of their lives are being given due attention as well.
Thanks, Alison. Morag, is there anything further to add?
I think probably it's all been covered helpfully, but in terms of the weekly calls, a lot of the content is about making sure that people feel informed, confident, and able to discuss some of the arrangements in relation to visiting, for example, to the vaccination programme, to the rapid testing and the analysis of that. So a lot of the arrangements, I think people have found it very useful to have such regular communication around the detail of that.
Thanks. Thanks, Morag. Gillian, is that quite comprehensive in the coverage of the areas that you touched on? I mean, I know you mentioned Care Inspector, but there were other bodies, various bodies mentioned there, and the logistical issues that are being raised. But what I would develop from your question is there a change? Is it static, the issues? Are you noticing that there is a trend in certain areas? From Gillian's question there, have they stayed relatively stable? I'll take anybody on that one.
Yeah, Tommy, I think my question more was around obviously, you know, at the start of the pandemic, there was a lot of concerns about PPE equipment, you know, into the for home support workers and care workers. And I'm just concerned now, obviously, you know, there's sort of no sight and end to the pandemic. How, as far as staff retention, how much of a problem is, you know, obviously working in a care home, it's probably, I would consider maybe high risk now, and how difficult is retaining staff in a high risk environment while still protecting those that are in the care home? But specifically as well, you mentioned that one of the care homes is, you know, there was a lot of concerns raised by the Care Inspectorate. I would really like more detail on, you know, all our care homes, how much of an impact, negatively or positively, has the Care Inspectorate had, and what's been the feedback as far as NLC run care homes?
Agree entirely. I think it's a question of timing, but I'll get the answer from the officers. I mean, that information has to come back, presumably on some form of inquiry. Am I right in saying that, Ross?
Clearly, all the Care Inspectorate inspections are published, so that they are out there. And I suppose just a reminder that we've only got Muir Park in terms of being in terms of in-house. And certainly in terms of the risk of working in a care home, I mean, I think that's been particularly reduced, obviously through the vaccination programme. And we've got a really high uptake now in terms of our care homes. So I think 93% of residents and 77%, I think it is, of staff have now had a first vaccination, and the second doses of the vaccination programme are just kicking off just now, and we'll be going back round. So that's been a great uptake. And I think there's a couple of national studies that are just will be reported formally quite soon. But what they've been looking at is the rate of infection in the community through the lockdown versus, and then looking at the same process through the care homes. So what we've seen in previous lockdowns is that the rate of infection and the rate of death in the general population starts to decrease quite markedly. What happened in the same time period in care homes was it was much less marked, so it didn't have as big an impact on the care home environment. This time round through this lockdown, what we have seen is a marked decrease in terms of both case rate and death in the general population, but a far steeper decline in both of those in care homes, and that's off the back of the first round of vaccinations. So the impact on the vaccinations makes quite a significant difference in terms of the safety of those environments. What I would say is I don't think we've had a significant challenge in terms of staffing of care homes, even through outbreak management, etc. Staffing of the care homes hasn't come through as one of our greatest challenges. However, I mean, I think Councillor Cafanan makes a very good point, and I think one of the things we have been talking through as a service is what will the impact of this be on our staffing situation come the end of the pandemic. And I think there's that sort of broad feeling that folk are right in the midst of it just now, feeling that they're I suppose doing their duty and working through. And when we get hopefully to an end point of this, then I think it feels I think it feels very likely that people will maybe do a wee bit of reflection and think, right, maybe that's time for me. So I think we are certainly looking at that. But at the moment, we've not seen a huge decline in terms of staff numbers or any increase in turnover.
Some more information there, Gillian. I mean, I agree with you. I mean, there has to be some form of localised, nationalised, whatever, report on this. But as far as the actual mechanisms ongoing just now, that's quite a bit of information we've had there. Hopefully, is it giving some assurances that, you know, the problems that were highlighted earlier this time last year, the PPE certainly been a cause célèbre of that. Those areas is that giving positive information there in those areas? Albeit that the phrase that Ross used, but an end point. There's an end point in this when the report retrospectively will have to be done.
Yeah, I mean, it does. I do feel more reassured, but I've obviously got a lot of concerns. You know, as a council, we've obviously got our home support. You know, we manage our home support staff to the best of their ability and make sure they've got their PPE. But obviously, there's a lot of private providers of home of support, care support, and they're maybe not as thorough as what NLC would be. And for me, that is still remains a concern when it's in a care home environment.
I don't want to leave that until the next, you know, the monitoring item. I want to take that one just now. If somebody's want to make an answer on a comment on that, Ross.
I don't know, Morag and Alison as well. If there's anything else really further to add. I mean, I know that there's some work going on, obviously nationally, in terms of an independent review in terms of the impact of COVID in the care home sector and how that was managed throughout the process. And that's looking at not just the local arrangements, that's also looking at the impact of the national guidance. And I think that's one of the things. I mean, if you were to ask me in terms of some of the critical elements of this, was the fact that particularly early stages of the pandemic, there was a lot of change, rapid change in terms of the overall guidance, and that was because we were just learning about it at the time. And particularly if you look at it, it was the same not just in care homes, it was the same across geriatric medicine and NHS as well, whereby it became clear, but it took a period of time to actually work it out, but it became clear that the standard signs and symptoms of COVID around identifying coughs and fevers, etc., didn't necessarily present like that in older people. And actually, in older people, the signs and symptoms of COVID were incredibly diverse, and it was the list. It was reasonably amusing actually when you're coming through and thinking, how are you supposed to enact this? Because you're looking at it going, it was hypertension, so high blood pressure, low blood pressure were both potential symptoms. And in the end, we ended up kind of distilling it down locally. If somebody's a bit off, just presume it might be COVID. And, you know, it was to that level that we're starting to have a look at it. So there was an awful lot of change through the system as it's progressed through. And I mean, I think the care home assurance process that we've got, and certainly can share a lot of information that's gone on. And there's a PFA committee, Performance Finance and Audit Committee of the IGB tomorrow, and there's a paper on Mars going to that committee tomorrow on the COVID update, and within that update gives you a sort of run through all the different aspects that were put in place for care home assurance and oversight, and the sort of timeline that we worked through. And again, that might give members a good understanding in terms of the pace that this was rolled out at, but also a sort of broad understanding of the different steps that we've undertaken. Happy to get that link shared around if that might help, but it's on the on.
If we could share that link, can we just clarify? Because I know that this is about getting a balance of care report here, but the care homes are part of that. But can we just clarify that we will be getting a report back locally at this committee? Scottish Parliament are working in theirs, society working in that one. We're all the way up to World Health Organization will be working in this. But a report will be coming back on the issues that Councillor Fannin have raised there, Ross. And that'll be
I mean, there's no issue at all with us bringing a report and scheduling that in for a future committee to talk through the COVID response. we've obviously been working this through as a Pan Lanarkshire piece, and we've got a full structured timeline of every step that was taken across the entirety of the pandemic. So we could very easily bring that together for the committee to set out step by step exactly what we put in place.
Great. Are you okay with that, Gillian?
I'm okay with that, Tommy. And if you would just allow me one more small question.
No problem.
Sorry for taking up everyone's
No,
time.
no, it's such an issue that we don't want to be leaving anybody uncertain in these areas.
Yeah, and I do appreciate your response, Ross, and I know how difficult it must be. It's unknown territory for everyone. I'm personally not a fan of independent living. I don't think from my experience and the people that I've worked with, I don't think it's great. But before COVID, I can only say in Cumbernauld, a lot of the people that I know that were moved on to independent living really suffered and really with isolation and just missed the people they were living with. And now, actually, because of the pandemic, they really are in a lot of cases really, really isolated now from family too. Well, they're independent living, and they're really only seeing their carers. So it is a concern for me that, while they're having this, being really isolated, living alone, that they also go into a care home, for maybe some respite. It would still, I'd imagine, be, quite isolated in the care home as well, because we're having vulnerable people with, maybe ill health or other needs. It might be difficult, for social distance to bring them together. So really, I think, I really don't know what I'm trying to say. I just think we're missing it. I don't know how you fix this situation with so many vulnerable people being in isolation. Can you fix it during a pandemic? I don't know.
Well, I mean, it's balance of care is the subject of the report, but there isn't a subsection of their balance of care in the middle of COVID. I mean, we are in the middle of the COVID, and at least thankfully that's been recognised. But Morag, it is important that being an area that some people do have problems with under normal circumstances, has it become more of a problem, as outlined by Councillor Fannin there, to deal with from an officer's perspective? And is there solutions, be they temporary or long term?
I suppose a couple of things jump to mind. One is that in terms of people being able to live the life of their choice and doing things that are important to them, I think it's essential that we don't just look at that as what service does that mean, but much more genuinely the outcomes that are important to them and how we achieve them. And for all of us, relationships, friendships, the role that we play in society is particularly important, and it should be no less important to people with disabilities, whether they're younger adults, older adults, have permanent disability or frailty. So it's really important that is recognised, and that we have got a focus of support which helps people connect in that way. Clearly, through the pandemic, it's been difficult because lots of people's usual connections, usual outlets, even contact with family has been in a very different form. And again, our relationship with the independent sector providers, as well as local authority provision in relation to support through the day, is very focused on how to try and maintain and protect that relationship, even if it's digital. And ensure that as the arrangements change in relation to isolation and social distancing, that we are working to reflect that in the support that's available to people. But I think we shouldn't underestimate what a challenging time it has been for the whole population, and for people with disabilities particularly.
Gillian, you're okay, happy with all that information fed back? We're all aware of the problems that are attendant and around us. But those are officer responses that hopefully have clarified some of the points.
Yeah, I do appreciate, and thank you for allowing me so many questions, Tommy.
No, absolutely no problem. If it's in your mind, it's in the mind of other members as well, Gillian. I appreciate you asking them. Claire, I know that you wanted back in this one, no problem.
Thanks very much for that, Tommy. It's just sort of following on from the conversations that are happening just now, Morag, with the you know, the care home providers and others. It's again, it's about learning. I mean, you hope to God we come out of this quicker, you know, sooner rather than later. And it's about looking at all the good things that have came out of it. It's about reflecting on the bad things, about doing the reports on the bad things and going through all of that. But it's also about taking on board a lot of the working practices that it's, you know, must do as a great master. And it's about that relationship that's been built up between yourselves and the care home providers. And can you envisage that there will continue to be that forum, because it's been so important within the pandemic, and to ensure the quality of care within the basically, which is the private sector care homes that we as a council are dealing with. That can you envisage that contact will remain, maybe not as often as being twice, maybe every couple of days or twice a week, but to keep that going, because if a decision is made by our people that one of our residents is to go into a particular care home, we want to make sure that care home is basically coming up to scratch. So that's my question.
Morag, it's an operational thing that you seem to be the eye of the needle of this, or the eye of the storm.
Absolutely see that what we have done over the period of the pandemic. I think we would all agree, including the independent sector providers across the whole system, so the care homes as well as the care at home providers have found that very beneficial. And I suppose the interesting thing is that perhaps what we would have done pre-COVID is maybe once a quarter have a big development session, so people would be in a room and you'd get poked together. So it was longer and more kind of people-based in terms of in being in the same environment. Whereas the opportunity to do this for shorter but more frequent arrangements, so even if it moved to monthly, you know, it would still be something which I think would be an important part of the way forward. And actually, in terms of time commitment to it, you can get an awful lot done in an hour, connecting and linking in from your service base without losing the time to travel, to park, to take half a day out, basically. So I think there's been lots of really interesting learning through the online platforms and digital platforms, which still make it quite engaging. And as we have got more used to it, breaking into smaller groups and having small discussions and coming back into the bigger groups, I think we've got a bit better at, and that definitely makes the sessions a bit more interactive. So I absolutely see that going forward.
Massive learning curve, absolutely, Claire.
Thanks for that. Thanks, Morag. Thank you.
Absolutely. I've got Willie, Councillor Goldie, on my list here. Willie, you want to?
Thanks, convener. I'm just going to come and do my usual harping on doom on the COVID situation. From a scientific point of view, all we can do is report back and try and learn from the earlier parts of it. We are going to have all sorts of long-term consequences on that. As Ross highlighted, the disease has many, many faces and will be with us for a considerable length of time, particularly with things like long COVID and all that. And I think really we can get tied up in knots and bringing reports back. We won't actually be able to know anything until we're through this, and this will be some considerable time. I think it's good to have reports brought back to see if we can improve things, if we can change things, anything we can do better, because we're always learning on it. But it's just there's no quick fixes with this.
Absolutely, Willie. I mean, you've got more experience in that area than most, if not all of us here. We know that, but when we're looking for status of what we're doing to address it, you know, there's an obligation on, you know, the department to give members assurance in the form of some form of report on that, or on the operations of addressing it. But yeah, absolutely, I 100% agree with you. It's going to be a long learning curve. Some experiences will be continued. I certainly am fed up dealing with these things and missing the cut and thrust of the chamber, but I think we're going. I think we're going to have to go into the next administration, and I don't even know if we're going to be there. But however, it's going to be a long, drawn-out experience. But from balance of care, in the report that we've got in front of us, we can see that there's a positive report there, if we can agree to report it. And on the point that you made there, Willie, is interesting. These are figures, incidentally, that are for last year, 18-19. It'll be interesting to see the figures when I'm saying reports come back this time next year and alterations and changes that take place there. But anything that I've given an assurance on to any member on the operation of, but to make members aware of how the department is dealing with an issue, they will continue. But as far as solutions, no, we're in the lap of the gods with that particular one, as Councillor Lowry says. Okay, can we agree to note the balance of care report then? And we've touched on some items here that on operational, it takes us on to the next item, which is on the performance report. We know we're in unique times, but Ross, you've given us a report here that there's a couple of areas you may wish to, salient points, you may wish to just highlight and touch upon. Thank you.
Thanks, Convener. So this is a performance report for Q2, which runs from July to September. So this is obviously right smack bang through the pandemic response. I suppose needs to be looked at in that context. As we normally do, we kind of focus on the reds and the ambers, which is a shame because a lot of the greens show quite significant, positive performance as well, and particularly through such a challenging time. In terms of section 2, we've got the enablement process in terms of the numbers completing the process marked as red. But I think important to note the fact that at section 2.3, the percentage of new or increased home support packages which commenced with enablement was actually quite considerably up at 77.8%, and it was actually just a reduced number of new cases coming through, which was probably quite heavily linked to the reduced activity for non-COVID reasons through the acute sector and hospital. So the numbers are down slightly, but actually the percentage that are going through enablement remained really high and actually had improved. And section in line 2.4, the percentage of individuals who had either no or a reduced level of home support required at the end of the enablement process was down slightly at 66.7% against the usual target of 70%. But I mean, I think obviously a huge amount of constraint around the service over that time period. And because of the impact on the acute sector, we were trying our best to provide as much as we possibly could within the community, and also battling through obviously with a range of staff absence related to COVID, etc. as well. So that probably gives an understanding in terms of the sort of operational pressures that were being dealt with, and actually the service stood up incredibly well in support of support people at home, and also in terms of supporting the hospitals as they were going through a really tough period. Item line 2.7 around the equipment service was just slightly below the 80% target, but as you can see, quite a significant improvement in performance over from Q1, so just below the 80% target. And I think the narrative picks up through the volume that the service has been working at, and that in Q2 included 7 million items delivered within 5 days of the request going in. So just to give you an idea of the scale of that service, so the service has done incredibly well to stand up during this period of demand. And while slightly below target, good to see an improvement from Q1. And we jump on then to page 78 and section 7 around public protection. The numbers of referrals past the care team for investigation was up slightly to 16.4%. And this is really a proxy measure in terms of the quality of some of the referrals coming in, and it's to try our best to get a higher percentage of referrals that actually end up at investigation stage. So slightly improvement, but not quite at the 20% target. And then again, in terms of 7.4, the percentage of adult protection referrals that didn't go on to investigation or to another service was at 51%. So an improving picture there again over Q1, but not quite at the 50% target. And I think the narrative within the paper on page 80 goes into some of the detail behind this. And we saw, and I'm sure Alison can chip in as well, across the entirety of public protection, where we saw a definite dip in terms of activity in Q1 but then quite quickly seeing the referral activity coming back up in Q2, but not necessarily through the same means. So we're noting in the report around the increasing number of referrals coming through from police and slight decreases around other agencies, potentially just reflecting the different time we're living in just now through the pandemic.
Yeah.
A couple of localities in Wishaw and Coatbridge seeing increases, while the rest have seen slight decreases, and then quite a significant reduction in Cumbernauld localities. Quite different pictures across the different areas that we've been working through. But certainly over that time period, we moved to much more frequent public protection chief officers group meetings, so that we could review these statistics and assure ourselves of the work going on in the background, and certainly have seen at least some degree of return to a more normal picture in recent times. But I don't know if Alison, there's anything else you want to pick up in terms of public protection?
Alison?
Thanks, Convener and Ross. Not really, to be honest. It's quite difficult quarter to quarter to read too much into fluctuations within localities or patterns of referral, although, as Ross said, there was definitely a dip across all areas in the very first phase of the pandemic. The overall referrals are up to levels that they've been in the past. But in terms of slight switches within patterns, it's difficult quarter to quarter to draw any conclusions. I suppose the one thing you'll see is as though the percentage conversion to investigations was not significantly changed. Those cases where there were full adult protection investigations as opposed to other actions which led to case conferences, there was a higher percentage there, which suggests, I think, there was really a focus down on and identifying those cases where there was the most concerns about risk, and those were fully taken forward, and there's some reassurance, I think, in relation to that. We also, I suppose, just to pick up on the previous discussion too, we always, as part of our monitoring around adult protection, look at activity that arises in care homes in relation to referrals, and that has continued through the pandemic as well, and there's not particular patterns of concern to report round about that. Perhaps slightly more in terms of incidents between residents, but not a surprise given the complexity of need and the circumstances that are that people are living within, and that more so than actual quality of care issues that have arisen.
As Alison and Ross have alluded to and referred to, is I do think that it's a testament to all staff involved that when you consider the service continuation, and there's only 3 areas there that go through as red. If you listen to Ross's explanations, they're not explained away, but they can be clarified. Gillian Fanning.
Yeah, thanks, Tommy. I'm just interested that the biggest referral came from the police, and from the kind of figures that I'm looking at, it would seem that the police are incorrectly referring people on for adult protection, perhaps maybe too easily. And it's good to see, maybe in Bellshill, and particularly Cumbernauld, the referrals are down by 38%. Do you think our partners in the police maybe need some more guidance or training on what should be considered an adult protection case, or do you think it's just it's easy for for their figures to pass on to social work quite quickly without really maybe investigating? And
Thanks,
it's
Gillian.
it's not really making a blame game here. It's just maybe it's a lack of training, a lack of information.
No, I remember asking Alison this question about 8 years ago when it was Pat's predecessor, it was the convener, is the police only too willing? So rather than just repeat the same answer, I do know that there was a report came, it might have been in the last cycle or the cycle before, in this whole picture here, and the police came out as the top referring agency. But Alison, in relation to that and the mechanisms and the specifics of the referral, are you happy that with the procedure as it is, drawn down from the experience of that report that came to us?
So the response of agencies, I think, including the police, is maturing, but I think one of the things that you can't see in the quarter-on-quarter trend is that actually the police, the percentage of referrals from the police year on year has decreased. And they do make a distinction. They make more referrals to us in relation to adult concern than in relation to adult protection. So I think they are making judgments about the 3-point test, and they are becoming, I think, more sophisticated in their own, I suppose, triaging of referrals. But if in doubt, they will pass to us as adult protection, and I think that's appropriate. We continue to have ongoing dialogue, and clearly if there are things that come through that are wholly inappropriate, we would want to feed that back through our multi-agency liaison arrangements and through the Adult Protection Committee, have that discussion. But whilst I think it's in the nature of the business, and particularly if you think that the police are picking up areas around particularly adults who are maybe a risk to themselves as well, where they're involved in self-harming behaviours, where there's a complex mix sometimes in relation to substance misuse and other things as well, and mental health. So it's not necessarily easy for them on the basis of the information that they've got to make a clear assessment at the time. So it's not perfect, Councillor Fan, but I think in terms of a sort of maturity of arrangements and the police being more able to route referrals appropriately, I think you will, if you look at it year on year as opposed to quarter on quarter, see some improvement in terms of arrangements.
That report I'm referring to, Alison, was that an annual report that you
Yes.
do on? There is an annual report that goes into that in more detail, Gillian. It can be drawn down.
Can I just ask one more question? A couple of years ago, the police were doing a big sort of campaign on destitute crime, rather than, you know, fining someone for stealing. They were, you know, if they were stealing nappies or baby food or whatever, then they were referring on to social work for more support. And I'm wondering how, in, you know, these maybe year and a half, 2 years since this destitute, you know, crime was recognised, have you any ideas what the referral rate would be, you know, with this type of crime to social work? And also, if you know, if you do have figures, has those figures increased during the pandemic, when obviously, you know, the people are in a more desperate circumstances?
Thanks, Gillian. From memory, I think there was an upward trend in referrals, adult concern figures. That'll be there, Alison, but does it refer to that specific area that Gillian's referred to?
I think that's something slightly different, and Councillor Fannin, you'll probably recall from previous committee that one of these initiatives came through the Community Justice Partnership. So it was actually an arrangement we had in place that there are certain types of crime where the police and the fiscal can make considerations of diversion, referral for diversion from prosecution. And there was a particular arrangement put in place about a scheme, Councillor Fannin's right, around where it was felt that there wasn't another sort of underlying dimension to it, and where it did seem to be about people who were shoplifting, for example, because of problems in terms of poverty or income, and related to that, where there was an option of diversion and also referral to our financial inclusion team. There was never very high levels of referrals through that scheme. I can certainly look and see in terms of current diversion activity and come back to you, Councillor Fannin, to see if there is how that's changed and if it's changed over the pandemic. But we actually found that although people felt that there was a high level of crimes which fitted that category, when the scheme came into play, there weren't a huge number of people identified as suitable for that, because quite often there were other issues involved as well. But I can get more detail on where we're at in relation to that diversionary scheme and come back to you with information about that, if that's helpful.
Okay, Gillian, that's something that we...
Yeah, that would be really helpful and appreciated, Alison. I mean, obviously no rush. I know you've got a lot more important things on. Just whenever you can get that information, that would be
No.
great.
But these are all related issues to the situation that we're going through, obviously. It's not just the health aspect that we've covered previously. I notice, if you're okay with that, Gillian and Alison's assurance to come back, I'll move on to the next name I've got, and that's yourself, Claire Bartley.
Thanks, Tommy. Again, I think it's the fact that there's so much within green and otherwise in amber. I think it really is testament to the officers and staff that have through this time managing to keep basically the service running. So really want to add my voice to that. I do have a question though, and it is about the adult support and protection. And I can see the variance for most of the areas is kind of what you would expect. But I'm a wee bit concerned about the Cumbernauld figure, because 38% down is really very, very substantial. And I was trying to remember from the last lot of stats of whether the Cumbernauld figure the last time was maybe hugely inflated, and that's why it's came down to roughly about the norms. And it is hard, and I agree, Alison, to try and do it quarter on quarter is really difficult. But is there anything coming out of the Cumbernauld area that would have highlighted concern that it's actually that it has went down by as much as 38%? Because to me that does seem to be pretty substantial.
Alison?
Councillor Bartley, no, I'm not aware of a particular issue, and clearly if that was a trend that would continue, we would want to interrogate that a bit more. But all of the localities do keep an eye to, and we pick them up in local performance reviews as well, just in terms of patterns and trends such as this. But I'm not aware that we've picked up a particular concern, and it does seem a big change. But I think we would want to see it over a longer period of time before we determined that it was an area of particular concern. There can be natural fluctuations, and sometimes there can also be a bit of batching of referrals from police as well, which can impact in which time period sometimes things are dealt with. So again, it's an area that would be happy to look into a bit further in relation to any specific concern, but it's not in itself something that I'm aware that we've identified a particular issue or one explanation for to date.
Thanks for that, Alison. No, I'm content to wait to see, and I fully understand that if there was any red flags would been raised for you, that you would be looking at that. So I'm content to wait to the next thing to see if it kind of it levels itself out. Thank you.
Yeah, that's it. I think the statisticians call that the seasonally adjusted figures over a period of time. We'll wait and see if there's a change there or a more acceptable, more palatable situation there. But those questions based on that area are interesting, and they bring to light the curiosities, the peculiarities of our own areas. Glad to see members have sight of that, and I'm glad that members have commended the efforts to everyone that has seen so few areas categorised other than green. Getting a red category in the middle of this pandemic is so few of them is quite a phenomenal achievement. Congratulations to all involved. You'll notice that one of the items there was on aids and adaptations in the equipment and how we're going to manage to spend any balance. And that is a nice bridge between that item and the next one, if we can agree to note that item, which takes us to funding available, which brings in Thomas, Leanne, and it's the, as we agreed, we put revenue and capital together. The capital budget been much smaller than revenue. They've come out to cover the period 10, and they are on pages 83 to 96. So Thomas, if you just want to highlight the salient issues there are significant figures certainly related to COVID that you want to make members aware of. Thank you.
Okay, thanks, convener. This is the services financial monitoring report as at 8th of January, which is accounting period 10. The service is anticipating a full year revenue underspend of £2.6 million. This total is aggregated from projected net COVID costs of £2.4 million, which has been offset by an underspend in core budgets of £5 million. The service's gross COVID expenditure totals £16 million, and the main elements include external payments to partners, the recruitment of temporary staff, staff overtime, the purchase of PPE, and delays in implementing savings programmes. To help prepare the forecast COVID costs, the service has received Scottish Government guidance and benchmarking data from other IGIBs to help ensure there is a measure of consistency around underlying cost and modelling assumptions. As a general point, however, there has been a nationwide reduction in forecast COVID costs when comparing the early submissions, which were prepared in March 2020, through to the current position. This reduction reflects updated model assumptions, for example, in the number of individuals who would require support, the number of staff who would be absent due to COVID, and the cost of recruiting additional staff. These forecast COVID costs will continue to be reviewed through to financial year end in light of actual costs incurred and any new Scottish Government guidance. Today, our assumption is that the Scottish Government will provide North Lanarkshire with in-year COVID grant funding of £12.4 million. The Council has received actual funding of £4.8 million to date, and further funding will be released following agreement of COVID costs, and this verification progress with Scottish Government and health service staff is ongoing. The financial position in respect of COVID grant will also be updated in future reports. The service is anticipating an underspend in core budgets of £5 million, and the key reason for this underspend is a general dampening in demand, coupled with a change in client requirements in areas such as SDS, independent care home placements and independent home care approvals. In addition, there has been a lag in activity in areas such as recruitment to vacant posts within the service. Across the country, IGIBs are involved in ongoing dialogue with the Scottish Government to determine how potential underspends can be best utilised to take account of ongoing COVID activity as we head into the new financial year. For example, can we convert these underspends into reserves in anticipation of meeting unmet or spikes in demand when the lockdown ends or eases? The Finance Service will be working alongside social work colleagues to ensure that we get a fair and flexible national resolution to this issue. Turning to capital expenditure, the majority of the service resource is dedicated to activity within the joint equipment store. The report highlights an underspend of £672,000, which similarly is a result of the operational impact of COVID, leading to an inability to undertake house visits and thereafter for contractors to access houses to complete installations. The service will be making future representation to the Council Strategic Capital Group to request this capital funding is carried forward to the next financial year, and I'm happy to take any questions.
Thanks for that, Thomas. As we said at an earlier meeting in this, the demand for those equipment, aids and adaptations, we might have moved on in time, but the demand will still be there. And I'm quite sure you'll put up a strong case for a continuation, either a carry over of that funding or sufficient funding to cover that and that balance that we haven't managed to disperse for the obvious reasons, the logistical reasons that you laid out there, that we couldn't get in, do the work. I suppose that the COVID issue, colleagues, is really paragraph 243. That is the paragraph that sums it up. Thomas, just based on that, the overall figure, which is worked out according to our nationwide allocation methodology. Are we right in assuming, am I right in assuming, as convener of the committee here, that the next financial report will see that money that is due to North Lanarkshire Council for period 12, that will be presumably, that will be put our way and will be dispersed accordingly?
Yes, convener, absolutely no doubts. We will get all the COVID grant that we are due. In terms of the release of that funding, it's more to do with kind of technical accounting matters, and we're in dialogue with the IGIB Chief Financial Officer and health colleagues. So I can give you that absolute commitment. We will get all the grant that we're due. In terms of those dialogues with the IGIB Chief Finance Officer, what's probably more pressing is we do get the flexibility to manage those underspends because of the ongoing COVID demand. And that's the kind of key issue for the finance service at the moment, to make sure that we're in as good a financial position as we enter the new financial year as we possibly can be. And obviously, as I indicated, we're working with colleagues in social work to make sure that's the case.
That's great, Thomas. And can I just clarify to colleagues that my reasoning for that question was no cynicism towards the Scottish Government and their funding allocation to this local authority. The cynicism was towards your colleagues that in theory are supposed to work as an integrated joint board along with us. But if you shake hands with us, the best thing to do is to count your fingers after it from previous experience in other financial areas to make sure that we get our money that's due us rather than them taking the lion's share. I don't see any questions other than the ones I've put to Thomas there. We're quite happy to note the report as it stands just now and hope that the next meeting, what do you call it, seasonally adjusted figures, we'll see some of these finances ironed out and notification of what can be carried on until next year in the case of the capital programme. Can we agree to note? Thanks very much, colleagues. Only one more here for noting, but it's worth a word or two. Morag, I know that you work into this as well as Thomas. It's a procurement document, but is it yourself that wants to lead on it? Because of the nature of it, a 10-year framework and the figures that's involved. Thank you.
Okay, thank you very much. A lot of the content in the reports that we've discussed today in terms of the balance of care, our relationship with the independent sector, the importance of working in partnership, are all the important elements in North Lanarkshire of how we ensure that people have got choice and control over the lives that they have and live independently and well in the community. And I suppose a prerequisite of having choice and control is that you've got things to choose from. So the procurement exercise is brought forward today as a way of strengthening the arrangements in North Lanarkshire so that people have genuine choice and control from a range of providers that we all have confidence in their ability to respond to people individually. So this framework brings together what previously was a framework for self-directed support and separately for care at home, on the basis that really the kind of thread through all of it is good quality, personalised individual support. So the exercise has been done to align these two frameworks to create a flexible framework for up to a 10-year period with an option at the end of each year to have people exit from the framework or join the framework. And the current combined resourcing of that is 82 million. So the way that is spent is very much on an individual basis, based on individual need and based on financial resources available. So you'll see in the report that the tender process has followed all of the Public Contract Scotland process. There were 71 notes of interest and 47 providers who submitted a tender and 47 who have been brought through onto the frameworks. This is about giving people who receive service the choice and control, but also the longer term confidence that the provision is from an organisation that's got a sound and partnership arrangement with us. It gives a longer term commitment to the providers, but does require people to be providing the quality of support that we would very much want in North Lanarkshire. It also, because of the way that it's been done, creates an opportunity for small local providers to do a bit better out of the process, because often smaller providers are not the ones with big procurement sections that can submit tenders on the basis of formulas that they've already established. So you'll see within the information that the evaluation was done across a range of key participants, but that the quality and cost split was 90% quality and 10% cost because of the way that North Lanarkshire works around self-directed support and individualised budgets. The emphasis was very much on the quality of support. The arrangement is supported into the future by very robust contract monitoring arrangements and increasingly making that information available on the website. A longer framework is very much the kind of national way of developing, and we're delighted that we've got this opportunity to work in this way in North Lanarkshire. Happy to take any questions, Councillor Morgan.
Thanks very much, Maureen. I see there is a question. It's Gillian that's wanting in. No problem, Gillian. So you want to ask a question? Gillian, can you unmute?
Yeah, I would just like to know if there's anything in place, you know, with these suppliers to ensure that the staff that they employ are being offered the same sort of rights and as what North Lanarkshire Council staff would be, as far as being, you know, being paid the living wage at least, and sort of offered, you know, the same protections that North Lanarkshire Council staff would expect. And is that a criteria, or is that not a criteria for anyone that we use as a supplier?
Gillian, you've read my notes. You were obviously at the conveners meeting, but I'll let Morag answer the question. That very point was raised, rightly so. Morag?
The conditions of service, the working arrangements in relation to the conditions that people are employed under is particularly important, both in terms of getting onto the framework in the first place and in relation to the contract monitoring arrangements as they go forward. And that includes commitment to pay the Scottish living wage. Yes, absolutely.
Is there under the Fairer Scotland duty section, they have to be that category, Gillian? Section 3.1.
And would we discount any supplier that didn't pay the living wage, or if you had any concerns around, you know, the treatment or of their staff? They automatically be discounted then as a supplier?
Morag?
It does depend a little bit on the circumstances. You'll see that there are perhaps supplier names that we are familiar with and ones that we are less so. So I wouldn't automatically expect a provider that's predominantly English, for example, to be paying the Scottish living wage, but we do need to get commitment that they will undertake to do that. I can confirm though that they virtually all are currently, so it's not you know, the commitment to pay the Scottish living wage is really already there.
Okay, Gillian.
How long do they have to fulfil that commitment? Is that written in a contract that they have to fulfil, you know, paying the living wage within a certain amount of months, or is it over years? I'm just potentially wondering how long staff would be working without being paid the living wage.
Well, can I read out the pertinent 2 lines? It says all the providers have indicated that they are either already accredited or are willing to become living wage employers.
No, I understand that, but what I'm saying is how long, what's the time scale that they have to actually become a living wage employer? If they're
my
not
interpretation of that, but I'll take the officers just now. My interpretation of that is they don't get the contract if they don't become a living wage employer. Am I right in that, Morag?
Yeah. Well, they don't get the work. Yes.
But potentially they could get the work on the basis that they are going to become a living wage employer. So my question is, how much time are they given to become a living wage employer if they're not already a living wage employer?
We would expect by the time that they were undertaking work in North Lanarkshire that they would be a living wage employer.
Okay, so to
So is that a kind of guarantee? I'm sorry to make a big issue out of this, but so can we as a social work committee then guarantee that not one single supplier will be given a contract in any way, shape or form unless they are a living wage employer, and they will not be allowed to start any work, any contract unless their living wage is in place?
Well,
is that a fair interpretation of the report, Morag?
yeah, so in terms of this report recommending that they go on the framework, but that the robustness around contract monitoring means that the balance between the two would be something that we would be assured of, yes.
Okay, and we've got our legal team monitoring these anyway. I mean, we've got the legal section.
Yes, we've had super support from procurement colleagues and legal colleagues in relation to the construction of the framework in the first place, and obviously the ongoing arrangements thereafter. So we've got very good support from both in order to make sure that we've got the best arrangements in North Lanarkshire, because clearly we want the arrangement to be good for the public in terms of people that would use service, good for frontline staff of the organisations, and create a robustness around the providers that sustains their service into the future.
Can I just ask one more question,
Gillian?
Convener? The North Lanarkshire, Hopes Watch staff, for instance, I think, do they have to be qualified to a certain level or have a certain qualification? And I'm wondering if these providers, these suppliers, would also have to, their staff would also have to have the same standard of qualification as what North Lanarkshire Council have before they're actually out in the community and, doing the work that our staff would do.
Suitability, eligibility, Morag, those factors, have they been taken into the equation?
Yeah, and we would very much draw parallels with how the council would provide service with how the independent sector provide service. And in terms of registration with the Care Inspectorate, there's clear standards around the expectation of workforce, which does include people being appropriately equipped to do the role. That doesn't always mean a level of formal qualification. It certainly means a basic level of induction and ongoing support. So there's a combination of both. And our experience is that generally the providers are in a similar position to us, that they've got a range of people who've got formal qualifications, are supporting people to get further qualifications, but have got people who are well trained and supported in the role that they're in.
And every single person would have to be, is it the SSSC you're registered with if you're working with, or disclosure checked and enhanced disclosure checked, every single person in that, that's working independently with these suppliers, they have to be registered with the care inspectorate, but also be disclosure checked?
Yes. And again, we would expect the same standard to apply across the independent sector providers as we would use ourselves.
Yeah, thanks for that information. Appreciate it.
That's helpful, and it's helpful in the sense that 90% is on quality, 10% on price, because the quality aspect pays more attention to those areas that Councillor Fallon has sought clarification on. And Gillian, from a personal perspective, I'm glad you're making sure that these are appropriate agencies, because I and many of us may well, this is a 10-year contract, be making use of these services in future years. In fact, I hope to be using them for a couple of decades, not just the one, in years to come. Thanks, a serious point, but thanks for raising them. And can we agree to give approval to that document?
Convener, Councillor Alan Valentine wants to make a comment.
Oh, sorry, Alan, didn't see you the comment there. Thank you. And you come.
Thanks, Chair. It's in reference to, again, the tender submissions. And one of the points Morag made was most economically advantaged tender, 90% quality and 10% price. Well, there's three different tenders there, and there's only one comes under that criteria. The other two look as if they're 80-20, but that's just me being picky. The other one is on page 103, and it's reference to the tender submissions. And I've underlined two things in it. The second bullet point down, employing local people, and 1/4 of the bottom, maintaining an office space within North Lanarkshire. Obviously, these tenders have been put forward, so they must be legal. But to drill it down that much, what does employing local people mean? Does that mean employing local people in, say, for example, if they're based in Cumbernauld, or Motherwell, or North Lanarkshire, or Lanarkshire, or the west of Scotland? And obviously maintaining an office base within North Lanarkshire speaks for itself, but I'm getting suggestions from other tenders and other committees that I'm on that it's actually quite difficult to have that as part of the tendering process, that you employ local people. Just clarification on those, please, Chair. Thank you.
Thanks, Alan. Thanks for raising it. It is a curious one, but we'll hear what the officers have to say from the perspective of this particular report. It's £820 million of money's worth after all. So clarity at this stage is when we need these points clarified. Morag, local people, how local?
It's an interesting point because in terms of the tender, it means people that live in North Lanarkshire, but clearly if you live on the outskirts of North Lanarkshire, then local could mean something slightly different. The intention behind it is that these services are responsive and flexible in relation to the time and place of care that people receive, and that generally speaking the workforce for self-directed support and for support at home is generally staff that live and work within the town that they are providing support, but it's not limited to that. It does mean that you might have some staff who have got access to easier travel to extend beyond that, but it means local to North Lanarkshire.
Alan, can I ask you? You said that other committees have spoken this, because this is a conundrum. This one, how local is local? What was the information that you were getting? Was it?
No, it's actually the other way about, Tommy. There's a meeting tomorrow, housing, and there's a contract up there.
All right.
And this is why, because they don't go through all these bullet points here about what they're, what they can and what they can't do. And what I'm wondering here now, I'm not trying to divide and conquer different departments in the council. What I want is clarification about, is this the same that's used in other contracts for other departments, not necessarily housing, but right across the board? The thing that Morag said about this, and she's right in a certain respect, is that it is very local. And you may be able to put that on it because of that. But the other point about maintaining an office base within North Lanarkshire suggests that you can put that. Whereas other contracts, well, I was going to say they're not as big, they're bigger than this, but they're no bigger than this because of the financial size of this one. But that's not going to one contractor. That 82 million a year is spread across, was it 47 contractors potentially?
47.
So that's maybe not quite, but it's my reading of the tender document, Tommy, that I'm trying to get here and get clarification as to whether it's across the board, whether this is specific to this tendering exercise, and if Morag can go back to the quality and price thing. As I went through it, there was 3 different ones there. There's only one of them 90/10.
Well, it's an interesting one that you've drawn attention to, because I've still to read my housing papers, and I will hope to hear that debate and that tomorrow. But it is the eternal conundrum where you draw the line local, because to a certain extent you can be cutting your nose off to spite your face. Because if Glasgow turned around and says we're only going to do local, how many people in North Lanarkshire and South Lanarkshire would lose out in that particular situation?
I understand. I understand.
I don't want to sound like Donald Trump, but it's the quid pro quo, isn't it? If they decide the same as if we decide, it can work against you the same as it obviously can work for you. It's,
I'm not-
it's an interesting one.
I'm not going for or against the decision, Tommy. I just want that clarification, if you know what I mean, right? I'm not saying one's right and one's wrong. What I want is
Absolutely.
some clarification.
It is a hard one, and I agree with you, and it'll be interesting to cover that one tomorrow. So it's in there as criteria. There are obviously aspects there that are certainly welcomed, like the community benefits, the living wage, those guarantees, the college places, so on and so forth. Morag, great report. I know a lot of background work went into it from other departments. Pass on our appreciation to them. That's the 47 recipients of contracts over the next 10 years. Some of them will be small and medium, some of them will be more large, but we'll give them approval today from the committee, and that will agree. If we can agree to note that report, that will
Convener,
do so.
Convener, Councillor Barclay wants to speak.
Claire, sorry, done it again.
No, it's all right. You're well forgiven. Don't worry. No, it's just a quick, and it's following on from what Alan has asked. See the community benefit initiatives that are included. Are these a prerequisite of them getting the contract, or is it that these were just things that they brought up to give their application extra weighting? Are these things that we demand as part of the process, or is it just things that they've said, well, this is what we'll do, that made it a good thing? It's trying to get that balance of what we've got. If you can get an answer.
No, it's a good question, and as with much of the responses like that, you'll see that in terms of the tables at the back, the providers are essentially ranked in relation to the quality of the submission that they made. So aspects like community benefit may score them higher rather than mean that they do or don't get on. So it's more about, there's obviously, they need to reach a particular standard, but beyond that, they would score higher the more that they were able to demonstrate some aspects like that, like community benefits and their understanding of what role they play in the wider community and how they give back to that.
Okay, Claire, once again, that is under that Fairer Scotland duty section, and it mentions even better there, it develops it, because it says further weighting can be given for disadvantaged groups, you know, and traineeships and apprenticeships and so on and so forth. So
I think I mean, personally, I would prefer that they were a prerequisite rather than just something that was giving added weighting. But I'm glad that there is added weight given to these provisions. But I don't know if it's possible to look at the side of it. Again, it's a big procurement thing, but that maybe there are these other aspects to be actually put down, like the living wage, that it's actually, if you don't do more of these, then you're not even considered in the first place. It's not that it's a difficult one, but I think it's quite an important aspect if we want North Lanarkshire to flourish.
Yeah, the more you put into the recipe, the more likelihood there is that some of them will walk away and we're left.
I know it's a difficult, difficult balancing act. But thanks for that, Morag. Thanks, Tommy.
Thanks, Claire. Any other points you need clarification on? Can we agree then that that's the framework for the next 10 years with those 47? And I'm right in saying, Morag, some may go off and more will be added over that particular period of time.
Yes.
Thank you. Colleagues, you heard me say earlier, I've started to look at my housing papers. That's what I'm going to do now after a coffee and a pancake. Hopefully you all go and enjoy the rest of the night, and you're not in the housing tomorrow, and you can enjoy the football. Thanks for your attendance here today. The excellent questions that I like to hear at committee that trigger off subsequent reports pertinent to keeping members fully aware of how our services are delivering excellent, much needed, life-saving services out in our communities. Much appreciated. I thank you for your attendance. Colleagues, thank you.
Thank you, Chair.
Thank you.